Hi, this is my friend Sam. How's it going?
Hi, pretty good. Pretty
Right
good.
on. Uh, this is your second time trying, but all the same. So today I'm going to be talking about how psychedelics can help with PTSD and different forms of treatment with that.
Cool.
Uh, you said previously that you don't have too much experience with that, correct?
Yeah, I know pretty much nothing about it, except that I've heard that some people use mushroom in like therapeutic offices for
For
like
sure.
PTSD.
That's actually something really fascinating to think about too. Is how people might do that. For one, is a lot of times when somebody might be using mushrooms or LSD or a lot of other forms of traditional hallucinogens, those two particularly, and also sometimes DMT, you would probably expect them to have. How would you usually expect them? You probably expect them to be talking if they're in therapy, or drawing, or potentially doing other things, right?
Yeah.
Yeah, imagine this. They're actually, generally speaking, the therapeutic guide for it is usually like sitting down or laying down pretty much the entire time, unless they need to use the bathroom or really need to talk at that moment, with like eye coverings on. With just eyes shut with like eye shades on, listening to music.
Oh my god. Huh.
Yeah. So I find that actually really cool. And with that as well, uh, you also know there's like a difference between using, like, let's say mushrooms versus MDMA, and there's actually a lot of research going into how MDMA could be helpful for people with PTSD as well. And for example, based on one study, uh, MDMA can research PTSD symptoms even for P, uh, in treatment for in cases by increasing certain neurohormones. Those pretty much are dopamine, serotonin, oxytocin, and by doing that, it pretty much modulates activities in the brain involved with fear, anxiety, and all of those negative feelings. And pretty much what that's saying is uh, what MDMA does is it pretty much makes you feel more, I guess, in that moment, it pretty much gives like happy chemicals, right? And through that, it can help people who've been trying to do all these treatments for long periods of time with PTSD, who've been struggling with PTSD, and to actually help them. And through that as well, this actually brings me to one of the potential critiques to of using psychedelics, especially traditional psychedelics for PTSD, which is the potential of having a bad trip if they're not in the right set or setting. And with that, like you can imagine, there's the fear of re-traumatization.
Yeah.
Like, let's imagine that somebody has already been, and let's say they've been mugged, as an example, and they try to take psychedelics with an intent of even healing, but at the same time, they're not ready, and they go outside their window of tolerance. You can probably imagine how, in the moment, if they feel like they don't feel safe in that environment, if they don't feel like there's somebody they're safe with, they could feel that fear again, and through that, they can actually develop new fears.
So is this why it's done with therapists and stuff?
Yeah, exactly.
I guess that makes sense.
Hmm.
It's just such a new field that
Yeah, exactly. A lot of research still needs to be done, of course, and something else too is like with versus and like for me personally, I would have thought that more research has actually been done with MDMA recently, but I would have traditionally I would have thought that it would have been like with more psilocybin versus MDMA, but according to another study, both treatments seem to have benefits beyond the FDA breakthrough designations of treatment-resistant depression for psilocybin and PTSD.
So do they have
MDMA.
typically long-lasting benefits?
Generally speaking, yes, but this is one of the things, though, is a lot of times, actually, people have been taking them, and then they have benefits for, let's say, 6 months, and then sometimes they start having symptoms again. And this happens, I've read about this happening with depression as well. But overall, there have been definitely long-term benefits.
So could that suggest that your brain maybe just gets used to the psychedelic chemicals and then it goes back into the state of like homeostasis?
That is hard to say, and not necessarily, because when I say it's after one trip, and after one trip they might feel great for like 6 months, if that's what you, or if you mean like it feels good, the psychedelic experience. One of the potential theories is that part of the reason why they feel better is because of the trip itself and the spiritual feeling from what they've gained from the trip, not just the chemicals. And by mean that by that is like what they experience, new ideas that they found during the trip that they've carried with them out of it.
So it's about sort of helping to live with the PTSD or the depression.
That's one idea of it, that's for sure. And there's also been research saying that, for example, with well, this is MDMA for one. MDMA is an upper, which has pretty much means with it having an increased amount of serotonin and dopamine, it can also. That's why it can help people with depression when they have, like, let's say, a lack of it. So it's, of course, it's hard to say at the moment, and there's people on both sides saying it could be either one, or it could be both, of course. Yeah. And something else, though, is going into with complex trauma as well, which, for if you know complex trauma, it's when people experience a form of trauma over long periods of time, and often from childhood. And it's something that isn't like, let's say, one car accident, but abuse over several years that can't be boiled down to a single moment. And there's actually been studies showing that there could be potential for psychedelics to help with complex trauma as well.
But so I've heard that people who have suffered like severe traumatic things, prolonged experiences, could have sort of it could be a negative takeaway of like mental illness from psychedelics.
And what do you mean by that? Sorry.
Like schizophrenia and things.
Yeah, like for example, I see what you're saying. And while there is a risk for some people, well, there is a risk for some people to develop schizophrenia, I wouldn't say there is I haven't seen much saying that there is a higher risk for people who've already trauma to develop schizophrenia after taking psychedelics, as much as people who are genetically predispositioned to maybe get schizophrenia, they might end up developing it.
Huh.
Though there is also potential for our people to develop a syndrome called HPPD, which is pretty much a form of not quite schizophrenia, but like mild hallucinations long after taking psychedelics. Though there's little research into that, and it is something that needs to be considered. Overall,
is that... Oh, sorry.
No, you're fine.
Is that what people call flashbacks, or is that...
It's it's like flashbacks for psychedelic flashbacks. That's what I've heard. Though I feel like there's also a difference as well between that, because I've also heard of people having a different form of flashbacks.
Yeah. So, would the psychedelics discussion about PTSD sort of be much similar to the one about depression?
It would be similar, but it would probably... There would be different similarities and differences for sure. While some of the drugs and treatment methods would be similar, I feel like, and of course, a lot of this is still from the era, I feel like a lot of it would be still be different. For one, while both do have to go with, I feel like, because there are of course different conditions,
Yeah.
and I feel like obviously needs to be more research, but and something else I was just, if it's okay, just think about say real quick, is with one is I'm not sure if you know much about like neuroplasticity.
Yeah, it's the concept of your brain can develop different neural pathways.
Pretty much, yeah. And with psychedelics, when people take them, they have increased neuroplasticity for a short period of time while they're on them. And with that as well, part of the reason why psychedelics can potentially help people with PTSD is that, let's say they take them, right, and they I've heard research of saying they almost return to like a childlike state.
I've heard that it's like when you walk across grass and all the fields get sort of plowed down, where all the fields are back up, or like if you're skiing, that
I could definitely see that, especially with grass and skiing, like making new trails.
yes, yeah.
I think I've actually heard that same metaphor before, and yeah, that's pretty much what it's like. And with that, there could be potential for both good and bad depending on the setting. So somebody with PTSD can retrain their brain to potentially not have as much traumatization, hopefully, but there's also the potential for more traumatization or re-traumatization.
So, do you believe you can do the psychedelic therapy without the trips, or with, like, well, I guess, like if they came up with a lab-created version of psychedelics that didn't induce trips?
Well, it's hard to say because some scientists believe that the trip is necessary and that the hallucinations are necessary because of the experience. But there's also research people saying that the neuroplasticity is what is important, is what's important. And based on research into microdosing, where people do have some increased neuroplasticity, but maybe not quite as much, it's hard to say. There is little evidence into saying that it is helpful so far. So it's of course, it's hard to say, but it could be, if there's ever is a drug that could do that, it would be really fascinating to see what the results do say.
So, do you think that research into these types of topics will be much easier one day if psychedelics are decriminalized?
Yeah, I definitely believe so.
And do you think that could be a net positive to the study, maybe?
I believe that, well, psychedelics, in my opinion, it's, while they're drugs, it's still, like, in my opinion, of course this is just me, it's like, it's still, it's a medicine, and I believe it could definitely be positive, but if you look into the past, we can't go too hard in one direction saying, like, it's a miracle drug, because even if it definitely has great results, unlike some things we've seen before, we need to take it one step at a time and treat it just like anything else.
Yeah. And I've definitely heard of people who have had great experiences with mushrooms specifically, and that's been like super helpful to them, and they carry through that their whole life. And people who have kind of, for lack of a better word, like abused mushrooms.
Yeah, no, I get what you mean.
In a negative.
I completely understand that. And I feel like, of course, it depends on the person, and it depends on the situation.
In the brain, I guess.
Yeah. Overall, thanks for listening.
Yeah, it was a wonderful conversation.
Thanks.
Thank you for having me.
That's all right, no problem.